And welcome back to the final segment of Pulse Television. I'm your host, Mark LeMay. Our guest, Dr. Joseph Gravel, our Chief Medical Officer and head of our Lawrence Family Medicine Residency program. We keep mentioning that, and I'm actually pretty proud of it because I think we have some of the brightest minds that come, and we can talk about, 900 applicants to the program that takes 10 residents, candidates a year. Mm-hmm. We talked about match day. We can elaborate on that. But tell us a little bit about the residency program.
Sure. So the residency program started in 1994. So the health center started in 1980. The residency was started in 1994. And why was it started? It was started because it was difficult retaining family physicians at the health center. It was difficult getting people going into family medicine, and that's actually getting better. But it was really an effort to produce more family physicians. Massachusetts has, based on per capita, we have the highest physician to population ratio in the country. But if you actually look at what the big teaching hospitals in Boston are producing, they're not producing primary care doctors. They're producing a lot of radiologists, a lot of gastroenterologists, a lot of surgeons, ophthalmologists. We need all that. But the thing that the health system definitely needs, and it's really becoming more and more recognized by everyone, is more primary care. There's a Mass Medical Society study done last summer. It's done every summer. And they looked at the percentage of family physicians in Massachusetts who are now accepting new patients. And it's down below half. It's down in about 48%.
So that sort of throws in the face of what we're trying to do with healthcare reform. If there's not enough doctors, it's tougher to see the patients.
That's right. So that's one of the lessons of Massachusetts healthcare reform that we were referring to earlier is, the analogy I use is you can give everyone a bus ticket, meaning they get coverage, but mm-hmm. you need to have enough buses.
Right.
And we don't have enough buses. So one of the things that our health center has done since 1994, and we've just expanded a bit in the last several years, is trying to produce more family physicians.
Now, clear something up, and this is one question I get a lot. Residents are doctors.
Yes.
They are MDs.
Yes.
They're not practicing. They're not in training. They are in training, but they're
yes.
not. They're not has-beens or wannabes. They are MDs.
Right. So the path is you do 4 years of pre-medical studies in college, then you do 4 years of medical school, then you do 3 years of residency training. So we have a residency training program. The vast majority of residency training programs are in hospitals. In community hospitals. In family medicine, about 2/3 of them are in community hospitals, the other third are in tertiary medical centers. This is a very unique residency in that we're the only residency in the entire United States that's sponsored by a community health center. We have in family medicine, we have about 30 other residencies that are training their residents, their physicians, in community health centers, but those are still employed by the hospital. Whereas in Lawrence, we actually have a nationally known model. I've been asked to speak all through the country about this model because there are now other community health centers who are looking at Lawrence. We've had many people. We've had people from Florida, we've had people from North Carolina, we've had people from California, some from Chicago actually come to Lawrence and see what we're doing, how did we do it, mm-hmm. because they're interested in replicating the model in those places. So it's a very hot topic right now is how do we get a primary care workforce?
I want to go back to what you were talking about a little bit earlier in the segment about why a program like the Lawrence Family Medicine Residency is important. And if we can bring up the slide to show the number of the workforce for starters, and then we're going to bring up a slide that talks about how many doctors we're graduating versus some of the other major hospitals. Explain this slide for starters.
So this is a combination of studies from both Johns Hopkins and the Dartmouth Center for Evaluative Clinical Science. And so the question is, how many primary care doctors do you need? What percentage of physicians need to be primary care doctors to get the lowest cost and the highest quality? So there have been many studies that actually have shown that the right number is between 40 and 50%. So as I tell people applying to our residency on interview day, the world would not be a better place if everyone was a family physician. There's a certain percentage, and the right percentage is half.
Critical mass.
There needs to be, it's very clear from the studies that we need between 40 and 50. If you look at it, the absolute perfect number would be 50%, because if you look at the 50% of percentage of generalists, that's where the quality is the highest, that white line, and the cost is lowest, right there. But our medical schools are not producing that. If you actually look at it, it's dropping, and it has been dropping for about a generation. We've lost a whole generation of primary care doctors. So where are we right now? We're at about 28%. So if you look at the cost of care at 28% on this graph, you see that that's a high cost. And that's what we were just talking about earlier, was that if you have too low a percentage of generalists, of family physicians, then you're going to get higher costs, and the quality is actually going to be less.
Another stat that I'd like to bring up is in regards to how the Lawrence Family Medicine Residency plays a significant role in healthcare due to the number of doctors that we're graduating. And I was actually surprised by this number. I know that we graduate 10 per year, but we actually graduate one of the highest numbers in Massachusetts.
Yes.
If we can bring up the bar chart to show the example, we graduate 10 per year. And that doesn't sound like a lot, but if you look at the chart, it actually is a lot.
Yes, and just to put in perspective, these are much larger institutions, obviously, than our health center in Lawrence. Boston Medical Center, up until last year, was producing 6 a year, to give you a sense. UMass Worcester, this is actually in 3 different sites. So in terms of the number of family physician residents in one site, Lawrence, believe it or not, is the largest site, the largest producer of family physicians in Massachusetts, despite all these major teaching hospitals. And again, it's because of somewhat of a lack of recognition about the importance of primary care. Frankly, there's economic reasons too. If you produce cardiologists, they will bring more money into the institution than trying to train a family physician. So it's all tied up frequently in economics, but health centers and the health center movement really is a major source potential source of producing a primary care workforce. And there was actually federal funding in the federal healthcare reform bill called Teaching Health Center part of the legislation. That was one paragraph in the bill that did set forth money to produce primary care doctors in community health centers.
And again, I want to bring this number into perspective. We graduate 10. How many applications did we get to come for students who wanted to come to Lawrence?
This year we had over 600 applicants. That's been very consistent. The thing that many people in the area, in the Merrimack Valley, may be surprised at is we're actually getting people coming to Lawrence from literally all over the United States. We have applicants. We actually did a map of where our applicants are coming from, and just about every state in the country is represented. So we're attracting people who in California and in the Midwest. We had numerous people from the South actually want to come to Lawrence. If you look at even just last year's class as an example, our intern class. Which medical school did we get the most of our first year class of the 10? It's the Ohio State University. So there are people in Ohio that know about Lawrence and know about this residency, and so we're getting the cream of the crop. People who want to be primary care doctors, they really think our mission resonates. They want to serve a community like Lawrence and in this area. They want to speak Spanish and learn to speak Spanish, so we have really a nationally known Spanish immersion to deliver care in whatever languge
and
patient speaks.
The ironic part is we have one physician, one resident, who's actually born and bred in Methuen.
Yes.
So he came back home.
Yes.
With Peter.
Yep, Peter Bastian.
And he came back home.
Yeah, and we actually had 2 applicants this year who were born at Lawrence General Hospital.
Interesting.
Who are at UMass, so it's interesting.
One of the keys to the Affordable Care Act is getting doctors and nurses motivated to work in underserved health areas. Does that make the residency program at Greater Lawrence even more enticing for new doctors?
I think that's the key to our success. Is it sounds a little hokey and whatever, but people just say it over and over again. It's palpable, the degree of passion and commitment. People even just coming in for a day. We have an interview day where they spend the entire day with us. They go, round in the hospital. They see and work with our residents a little bit, meet our residents. They meet our faculty, and the one thing that does come through to them is just that there's a real sense of commitment and a passion to not only deliver health care but actually serve a community. So it's really I think the key thing is it's about service. It's not people who go into family medicine believe that diseases are interesting, but they think that the people with the diseases are a lot more interesting. And so, I think we have 3 behavioral scientists, psychologists that work with our residents. There's a very holistic view of healthcare of trying to serve people in the community that they're in, go into the community. We have our first years actually interacting with the kids at Lawrence High School on Monday afternoons. So it's not just spending time in the hospital. Sure, they learn ICU care, they learn how to take care of patients in the hospital, in the nursing home, in our health center, but it's really a community program, and that's something that is quite special about both the community health center and the community hospital program. It's about the place that you're in rather than a big tertiary medical center.
We're up against the clock, but there is one more statistic and one more graphic that we want to put up, and that's the future of family medicine and the future of the residency program. There have been funding cuts in the past year or so. Does that put the program in jeopardy at all?
It's definitely very challenging. The health center is extremely committed to this residency program, and it is doing everything it takes to preserve the program and have it flourish. And the nice thing about having the dual roles I have is I see in a very tangible way at meetings and things just how committed our CEO and our senior administration and our board of trustees is to this program. But I will say that it makes it very challenging to preserve what we have. When the state a couple of years ago actually eliminated entire funding for our residency because they're eliminating funding for everyone. Some of the big tertiary medical centers can absorb that kind of cut. With our cut, it was close to a quarter of our income, so it was a much bigger percentage. It was a disproportionate effect on a small program, relatively speaking. Small meaning not in terms of family medicine, but in terms of the number of residents, versus Boston Medical Center and some of these other larger institutions. So we spend a lot of time trying to get the word out to our legislators. Fortunately, we have a very supportive group of legislators that understand our mission, what we're about. We've been very involved with educating legislators outside of Lawrence and outside of our own legislators in the state. We actually started a legislative day at the State House to just make sure we educate everyone to understanding that the impact of the funding cuts to training primary care doctors is really the total opposite to where we need to go. And because there's no distinction made between if you're trying to produce a primary care doctor versus producing a radiologist, everything got cut the same. What we're asking for is a little bit more targeted approach, a little bit more strategic approach to ensuring that we have enough primary care doctors to serve the people that live here.
Well, Dr. Gravel, it's been educational for me, and I get to work with you every day, but certainly this has been an educational hour for me, and we hope it's been an educational hour for the viewers as well. Thank you for joining us on our first episode of Pulse Television. It's been a pleasure having you. Thanks, Mark. Big thanks to you, our audience here in the studio. Thank you for coming out for this edition. A big thanks to the volunteers here at MCTV in Methuen for manning the cameras and back in the booth. And again, thank you to you, the viewer, for joining us on this edition of Pulse Television. Until next time, I'm Mark LeMay. Have a healthy day.
Oh, thank you.